Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience who are joining us from different parts of the world to today's Health Awareness Series webinar, which is being brought to you by Imamia Medics International Women's Wing Connecticut chapter. You are watching us live on the YouTube channel of Imamia Medics International, which is known as MyTV. Without any delay, we'll begin today's webinar with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Translation. In the name of Allah, the Merciful, the Compassionate. Say, He's Allah, the One and Unique, Allah, who is in need of none and of whom all are in need. He neither begot any, nor was he begotten, and none is comparable to him. Sadaqallahul Aliyyul Azim. Once again, I welcome and thanks all our audience who are here to watch an important episode from the Health Awareness Series being brought to you by Imamia Medics International Women's Wing Connecticut chapter. And from the Connecticut chapter, we have our very esteemed moderator for today's program, and I'd like to introduce her. We have with us Dr. Sheba Zedi. Dr. Sheba Zedi is a board-certified orthodontist. She is the chair of Imamia Medics International Women's Wing Connecticut chapter, and she is the owner of 3 private practices in Connecticut. She is a graduate of Tufts University School of Dental Medicine. She has dedicated her career to excellence in orthodontic care, mentoring colleagues, and advancing interdisciplinary education in dentistry. Dr. Zedi is passionate about empowering women in healthcare and serving the Shia community through faith, leadership, and service, all while balancing her role as a proud mother of 3. We are honored to have you, Dr. Sheba Zedi, with us, and over to you.
Thank you. That was a very warm welcome. And Assalamu alaikum to everybody. Today, we are lucky to have Dr. Zainab Nawab presenting Obesity and Diabetes, a New Era in Treatment. Dr. Nawab is very dear to me because she is my bhabhi. She graduated from family medicine, primary care in University of Massachusetts in 2004. For a few years, she was working at UMass Hospital, and then she moved into private practice. She has a private practice in family medicine in Westborough, Massachusetts. She has always been interested in aesthetic care and aesthetic medicine, and she also has an aesthetic practice. So besides this, what I can tell you about her is that she is very warm, very loving. She is very well loved by her patients because of the amount of time and care that she provides for them. She's also a great cook, and my kids just absolutely love that. So I now will turn it over to Dr. Zainab Nawab to start her presentation.
Thank you, Dr. Sheba. I really appreciate the introduction. And again, I'm here because of her. So thank you for the opportunity. And assalamu alaikum, everybody. So as she already introduced me, I'm a primary care physician in Westborough, Massachusetts. And today we will be diving into topics of obesity and diabetes, which are the 2 most common health concerns that we have in our lives right now. And I will be discussing what options we have to treat these since these present in our day-to-day lives. So let's start by asking ourselves, what is actually obesity? We probably all know that it actually, in lay terms, it means that we are fat. And that means that we have too much of body fat in our body. Typically, this is measured by something called body mass index, also known as BMI. Normal weight falls in the BMI of between 20 to 25. And if your BMI is 30 or higher, that is considered to be obese. And why does it matter? Basically, higher BMI can affect your health in multiple ways, causing chronic illnesses. And that is why it is so very important that we take care of ourselves and watch our diets. So, next slide. Obesity actually is a public health concern too. And that is because over 40% of adults in America are obese. People with obesity develop various chronic illnesses like diabetes, which is very common. We all know about diabetes. Also, it can cause heart disease. It is also linked with high blood pressure and vice versa. And also, it causes many cancers like colorectal cancer. In fact, colorectal cancer is one of the leading causes of death in this country. They've reduced the guidelines. So, definitely, diabetes and obesity matter a lot. Also, it causes other cancers, especially in women, called endometrial cancer. It can cause gallbladder cancer and kidney cancer, and many, many more. So not only does it affect medical health or chronic illnesses, it can also affect our energy. It affects our mood and also our quality of life. And that is why it's so very important that we address obesity in our lives. So, and so now, like that, we talked a little bit about obesity. Let's link obesity to diabetes. There is a huge connection between these two. Being obese or fat is one of the biggest risk factor of type 2 diabetes. When we carry extra body fat, it makes it harder for our bodies to control blood sugar, and that is called insulin resistance. What insulin resistance is in general terms is that basically your body cells stop responding to the insulin. Think of your cells to be your house and insulin as the key to the front door. So typically when you eat in normal individuals, when you eat any meal, it actually converts into sugar, which then enters into your bloodstream. Insulin, which is the key to the door, unlocks the door and allows the sugar to come into the cell, which is the home, and then provides energy. So this is your normal cell. And this is the next slide, which I would like to review. So that when you're a diabetic, what happens is the insulin, the cells that are there, they are becoming unresponsive or less responsive to the insulin, so that blood sugar does not enter into the cells and it stays in the bloodstream, causing blood sugars to rise. And that is actually called diabetes. So and then in that case, the blood sugar rises, diabetes worsens, and then you have, other problems. Also, what happens is once you're, then the more the insulin is, so then with that, the pancreas secretes more insulin into the bloodstream, and then with that ongoing squeezing of the pancreatic cells, pancreas eventually fails. So how do we become fat? So now that we know the mechanism of what causes diabetes, we also need to find out how do we typically become fat? We are not typically born with being fat. We over the years eat more calories than the body uses. We do not do much of physical activity. There is also a predisposition of family history and genetics that causes us to become obese. There are certain medications. Nowadays, there is a whole trend of people taking all these medications, and those medications can also cause obesity. And other health conditions can increase the risk of obesity and being fat. Stress is an important factor because stress increases cortisol levels, which actually promotes fat storage, causing us to get more fat. Being bored, that also increases the obesity because we just get bored and just sit and have chips or just eat more. So now that said, how do we prevent this? By creating healthy habits. We want to eat a balanced diet. We want to eat more fruits and vegetables, incorporate more whole grains into your diet, substitute the sugary drinks like sodas or juices with water, and avoid eating processed foods. We want to try to be very active. Try to at least incorporate 30 minutes of activity in the day. Try to get good amount of sleep. Poor sleep habits actually reduces motivation and physical activity, and that also causes impaired decision making by affecting the brain, making us to have unhealthy food choices more tempting. So how do we try to incorporate, how do you make yourself to eat healthy? You want to, you in this plate, actually, it shows that half of the plate is full of fruits and vegetables. You want to try to do that. You want to choose water instead of the sugary drinks like sodas or juices. You definitely want to watch portion sizes. Typically, I have patients come in and tell me like, oh, I'm eating very healthy and I'm still gaining weight. But that's not the only reason. Healthy eating is not always um, it's good. You need to also watch your portion sizes. You want to try to cook at home more often. It's so easy with our busy lives that we just kind of use the DoorDashes and the Grubhubs to order food. However, it's very, very important that we try to cook healthy, because when you cook at home, you actually incorporate much better ingredients and also try to eat healthier. So definitely that's something that you need to consider. Also, in addition to that, you want to find activities that you enjoy. So, because physical activity matters quite a bit, that's the way you burn the fat that you're accumulating over time by eating unhealthy, etc. The stresses that we go through. And it doesn't really matter what kind of physical activity you choose. You could just be walking, but try to walk a little bit briskly. Try to do 30 minutes every day, maybe 4 to 5 times a week. Try, if you like dancing, that's fine. You can do biking, you could do swimming, any kind of activity that you can be consistent and persistent with. That's the kind of activity that you incorporate. You want to try to move throughout the day. We have these Fitbits and Apple Watches that track your movement throughout the day. You want to wear them so that way at least you can count those steps. At least try to do 10 to 15,000 per day. Take the stairs instead of the elevator. Park further away from the store. If you go to the store, don't try to park next to the door, thinking that you're going to be carrying groceries and it's going to be harder. Go further, park further out, so that way you can walk and make those steps. Movement is absolutely very, very important. Also, sometimes when you exercise, you want a partner. You want somebody to do that with you, because it can be very boring. You want a family member, or you can, maybe text your friend and say, let's go for a walk together. And that increases your motivation to do exercise and burn the fat that you have been adding to yourselves. So sometimes with healthy eating and regular exercise, people still struggle to lose weight. We've talked all about the healthy eating, exercise. Yes, they're all very, very important, but sometimes it is very hard. Perimenopause is another phase where it's very hard for them to kind of lose weight. So in these cases, medical treatments can help. That's where medications come into play. And now it has become so very exciting that these new medications have been in the market, and it's easier and safer for patients to take these without any side effects, or without much side effects, I would say. So the classes that I would like to talk about, there are multiple medications for weight loss. However, these newer medications are very, very effective and safe to take. They're called GLP-1 agonists, and you would probably know them by Ozempic and Wegovy because they've been quite widely advertised. They help with weight loss as well as diabetes. And so let's, talk how they basically work. They slow down, they actually make you feel fuller. How it does that is by working on the GI tract in the stomach as well as in the intestines. It slows down how quickly the food leaves your stomach. So you feel full, and then it signals to the brain that now you're full and do not add more food. So that's how it causes you to eat less and stay full. It also helps to release insulin after eating meals, and that's how it helps to treat diabetes. So basically, these came to the market more for diabetes control. However, when the studies were released, it was seen that there's a lot of weight loss happening, and that's how it was actually targeted towards obesity and management of that. So with that, people have started losing weight, they lower sugars, and the diabetes is getting well controlled. Because diabetes is getting well controlled, that is reducing the heart disease, it is lowering the people's blood pressure, it is controlling cholesterol, and also improving inflammation. I forgot to mention earlier that extra fat in the body also causes inflammation, and that inflammation actually is quite dangerous to your body because that can increase the risk for heart disease. And so these medications, by doing all the things that they're doing, is actually helping to lower that risk. So in addition to, so initially the GLP-1 came to the market. Then just few months later, or maybe a few year, or like a year later, a new class called GIP/GLP-1, which is dual agonist, also came into the market. And these medications are available in the form of Mounjaro for diabetes and Zepbound for obesity. They're basically the same medication. However, they are just marketed differently so that you get, for insurance purposes, that Zepbound is considered for for obesity and Mounjaro is for diabetes. So GLP-1s are great. However, the dual agonists are actually even better because they control the weight loss better and also help to improve blood sugars much better than just GLP-1. So now, while I mentioned the benefits of these newer classes of medications, it may not be applicable to everybody. You have to understand that, it's just not like, just you have to just go and get it and it's going to be fine. All medications come with side effects and, issues in the future. Overall, as I said, they are definitely much safe. First of all, they need to be prescribed and monitored by a doctor. They are also available in some markets as a self-pay option. However, don't risk your health or on someone or a company that actually promises you a cheaper option and with little or no monitoring. So definitely you make sure that you're actually going to either your primary care doctor or your endocrinologist to have it prescribed for you. While they are really good by themselves and help to reduce the weight as well as diabetes, you want to definitely combine them with healthier eating and activity. That way you get actually better results. And as I mentioned earlier, yes, they're pretty safe and effective. They do still come with side effects, and the nausea and this stomach upset can be trivial in most cases. But I've seen patients who just go up on the dose like very rapidly, and they can get really severely sick, needing them to go to the hospital when they need IV fluids, etc. And they're really causing pancreatitis, all that stuff. So just be careful, and you take these medications under the monitoring of a physician. So how do you actually take this medication? It is obviously a prescription. It's not available as like just without a prescription. So you actually get it through your doctor. It comes in the form of a weekly injection. It comes in a pack of 4. It could be either Ozempic or Wegovy or Mounjaro or Zepbound. As I said earlier, Zepbound, Mounjaro can be a little bit more effective than the others, but essentially they are the same. It also depends on what insurance is covering, so you definitely want to confirm with your insurance before you do that. But they are very easy to inject. It comes in the form of a pen. Even people with having needle phobia, they are pretty okay with taking these pens because the needle is really not visible. As it's shown in the picture here, it's like that pen, you just kind of like press the button at the back and you just kind of stab yourself like an EpiPen. Some of the people might know how to inject EpiPen. It's pretty much very similar to that. And it takes like less than 10 seconds to do this injection. And that's it. So, and the only thing is like you're required to refrigerate the box when they come in. So it's well tolerated, safe to use. You can inject it in your abdomen, you can inject it in your thigh, you can inject it in the arms. So that it's pretty easy. So I think so to sum it up, obesity and diabetes are very closely linked, and healthy lifestyle habits are the foundation of prevention and treatment. But now, because we have these 2 new medication classes, GLP-1 and GIP/GLP-1 agonists, we have powerful new tools to help people lose weight and control diabetes. Small changes really make a big difference. So definitely try to incorporate healthy lifestyle, which is a foundation of our lives, and work towards exercising, being physically active, to prevent all these chronic illnesses and reduce your medication load in general. So that is it. And I really appreciate your attention. Thank you. And I could open it up for questions.
Sure. Thank you so much, Dr. Zainab. That was very informative. I'll request Dr. Shiba if she'd like to go over the
Yes.
questions.
तो बहुत अच्छा लगा डॉक्टर ज़ैनब, आपसे ये सवाल पूछना था कि ये जो दवाएँ हैं, ये सेफ़ है, नहीं सेफ़ है, इनके साइड इफ़ेक्ट्स क्या होते हैं और इनको लेने से क्या तकलीफ़ हो सकती है?
वैसे तो बहुत सेफ है। आई मीन एनी मेडिकेशन यू टेक उसके साइड इफेक्ट्स होते हैं। मोस्ट कॉमन साइड इफेक्ट इज नॉजिया एंड जीआई, लाइक बेसिकली डायरिया। तो उसको अवॉइड करने के लिए यू वांट टू स्टार्ट वेरी स्लोली। यू डोंट वांट टू स्टार्ट एट अ हाई डोज। लोगों को लगता है कि ओ ज्यादा लेंगे तो ज्यादा फर्क पड़ेगा, ज्यादा वेट लॉस होगा, ज्यादा ब्लड शुगर कंट्रोल होगी। बट यू वांट टू एक्लिमेटाइज योर बॉडी by starting small and increasing the doses. So basically starting at 0.25 or 2.5 milligrams. अलग अलग मेडिकेशन के अलग अलग डोजेस हैं, बट nausea और डायरिया इज द मोस्ट कॉमन साइड इफेक्ट। बट धीरे धीरे शुरू करो और इंक्रीज करो तो बिल्कुल वो साइड इफेक्ट्स मिटिगेट कर सकते हैं हम। तो एक महीने टिपिकली एक चार चार एक बॉक्स में चार पेन्स आते हैं, एंड इट्स वैलिड फॉर 1 ईयर 1 मंथ। तो एक महीने के लिए वो डोज करो, एंड देन यू इंक्रीज इट टू द नेक्स्ट डोज, एंड दैट्स हाउ यू रिड्यूस द साइड इफेक्ट्स। बट ओवरऑल इन जनरल इट्स वेरी safe. It can also, like actually diarrhea in some cases, but most commonly also constipation भी काफी हो जाता है, and that is because the way it works by reducing the motility of the GI tract. तो basically वो जो intestines होते हैं वो move नहीं करते हैं, and that is why वो constipation होना शुरू होता है। And so हम patients को बोलते हैं कि in addition to the injections, why don't you start with either like some constipation medicine like Miralax ले लिया, या Dulcolax ले लिया। एंड इफ यू ईट मोर फाइबर वो भी अवॉइड हो जाता है। एंड पानी जरूरी है पिए, बिकॉज वैसे भी भूख नहीं लगती है, प्यास नहीं लगती है, बट यू वांट टू मेक श्योर दैट यू एक्चुअली एडिंग मोर वाटर एंड फाइबर टू योर डाइट टू अवॉइड दीज साइड इफेक्ट्स।
अच्छा, दूसरा ये सवाल है कि शायद ही कोई औरत होगी जिसे नहीं लगता कि उसका वज़न ज़्यादा है। तो मतलब ओबीस कहने के लिए कितना वज़न होना चाहिए है, और ये दवा लेने के बाद कितना घटा सकते हैं आप वज़न?
सो टिपिकली ओबेसिटी जैसे मैंने अर्लियर स्लाइड्स में बताया, ओबेसिटी का डेफिनेशन इज 30 BMI और हायर। और वो BMI हाउ कैसे कैलकुलेट करते हैं इज बाय वेट एंड हाइट। तो आपका हाइट और इजीली गूगल पे मिल जाती है कि आपकी BMI क्यों, एंड द रीजन इज वो डेफिनेशन के लिए है और वो इंश्योरेंस के अप्रूवल के लिए है। सो वैसे तो कोई यू कैन इंजेक्ट दैट ऑन अ रेगुलर, लाइक एन एवरेज हेवियर पेशेंट। तो और दूसरा है कि यू एक्चुअली लूज अबाउट 10 to 20% ऑफ योर वेट in the first 3 months, 12 weeks में to 12, it's approved for 52 weeks, which is एक साल में, and you can actually lose about 10 to 20% of weight during that time. तो काफी फर्क पड़ता है। People lose significant amount of weight if done correctly. And to maintain it, you actually just don't want to depend on the medication itself. आप साथ साथ में एक्सरसाइज, हेल्दी ईटिंग करें तो और फर्क पड़ेगा।
क्या ये दवा हमेशा लेना पड़ती है? और अगर जब ये रोक दें दवा लेना 1 साल के बाद, तो फिर क्या होता है?
सो इट्स लाइक अ मेडिकेशन। जैसे आप डायबिटीज में या ब्लड प्रेशर की दवाई, कोलेस्ट्रॉल की दवाई लाइफ लॉन्ग लेते हो, राइट? एंड जब ये सही हो जाता है तो यू कैन स्टॉप इट। सो दिस इज सिमिलर टू दैट। आपने लेनी है ये दवाई, इफ यू स्टॉप इट एट सम पॉइंट वो वेट वापस आ जाएगा धीरे धीरे, अनलेस यू ट्राई टू मेक ऑल दोस चेंजेस परमानेंट। लाइक आपने सही खा रहे हो, पोर्शन कंट्रोल कर रहे हो, फिजिकल एक्टिविटी कर रहे हो, एंड दवाई ले रहे हो। You can always reduce the dose to the lowest level जहाँ आप tolerate कर पा रहे हो, but to answer your question, basically you can take it a lot longer, and you can continue it.
अच्छा, तो ये इंश्योरेंस जो है वो, अगर आप चाहते हैं कि आपका इंश्योरेंस अप्रूव करे तो क्या कर सकते हैं? और अगर ना करे तो क्या आप खुद खरीद सकते हैं? इनकी क्या प्राइस क्या है इन दवाओं की?
सो इंश्योरेंस विल कवर, ये दवाइयाँ डेफिनेटली कवर करती हैं। थोड़ा मुश्किल होने लगा है अब आजकल, बट इन जनरल इंश्योरेंस कवर करती है। तो हम क्या कहते हैं पेशेंट्स को कि गो कॉल योर इंश्योरेंस एंड फाइंड आउट कि कौन सी दवाई आपकी। सो बिकॉज वी आर डूइंग टू इंडिकेशंस, डायबिटीज और ओबेसिटी। ओबेसिटी में थोड़ा मुश्किल है, यू हैव टू हैव अ BMI ऑफ 30 एंड अबव टू गेट इट कवर्ड। या तो फिर 27 BMI हो तो एक और मॉर्बिडिटी विच इज लाइक डायबिटीज हो गई या हाई ब्लड प्रेशर हो गया, तो उससे कवर हो जाती है। और डायबिटीज में इट कैन बी कवर्ड ओजेम्पिक या तो मंजारो, दोनों कवर होती है। इंश्योरेंस, सो पेशेंट्स को हम बोलते हैं कि आप जाके कंफर्म करो आपका प्लान कवर करता है कि नहीं। In spite of coverage, we still have to do something called prior authorization. Prior authorization मतलब अप्रूवल है कि अच्छा पेशेंट को चाहिए, तो हम लिख के दे देते हैं उनको इंश्योरेंस को कि पेशेंट को जरूरी है एंड वी हैव टू डू इट। बट ये थोड़ा 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 टाइम लगता है ये सब करने में, लेकिन ओवरऑल once it's confirmed by the insurance, it is covered. Some insurance nowadays are not covering it, and the reason is because some patients don't come for regular follow-up. वो regular follow-up करनी पड़ती है to show them that their weight loss has happened, because दवाइयों ने prove किया हुआ है कि 5 to 10% in the first 12 weeks आप lose करोगे। आप दवाई लोगे और follow up नहीं करोगे and you're not showing it to the insurance, we actually have to play this game. And then you have to tell the insurance कि हाँ ये patient ने improve किया हुआ है, and then they will actually cover it ongoingly. और सपोज नहीं भी कवर किया हुआ है, आजकल दीज फार्मास्यूटिकल कंपनीज विगोवी एंड जेबाउन ने सेल्फ पे ऑप्शन भी रखा हुआ है। इट इज अप्रॉक्सीमेटली $499 टू $699 पर मंथ का कॉस्ट है। तो इट इज एक्सपेंसिव, ऐसे नहीं है कि इट्स इनएक्सपेंसिव मेडिकेशन। तो जितना जैसे हो सकते हैं इंश्योरेंस को कवर करवा लें आप, एंड दैट वे यू कैन गेट द मेडिकेशन।
एक क्वेश्चन अभी डॉक्टर मेरीन पूछ रही हैं कि इज देयर एनी ड्रग ड्रग इंटरेक्शन विद adult diabetes medications?
So not really. You don't, there is no drug to drug interaction. It's a very safe medication, but you want to make sure that the patient does not have history of pancreatitis. जैसे बेसिकली वो जब भी मैंने कहा था कि वो पैंक्रियाज जो इंसुलिन सिक्रीट करता है, सो यू दैट्स एन ऑर्गन, वो एंड इट वर्क्स ऑन दैट ऑर्गन आल्सो टू सिक्रीट इंसुलिन। तो जब भी हिस्ट्री ऑफ पैंक्रियाटाइटिस होती है, आपको पता होगा ये, लाइक यू वुड हैव नोन इफ यू हैड हिस्ट्री ऑफ पैंक्रियाटाइटिस, तो वो हिस्ट्री है तो आप कॉशियस रहिए। इट्स नॉट अ कॉन्ट्रा इंडिकेशन, दैट मीन्स मतलब कि आप ऐसे नहीं कि नहीं ले सकते हैं, यू हैव टू बी कॉशियस अबाउट दैट कंडीशन। आपको है तो यू बी कॉशियस एंड टेक दैट मेडिकेशन स्लोली एंड स्टेडली। और सो दूसरा है कि आपको थायराइड कैंसर है, उसका भी एक कॉन्ट्रा इंडिकेशन है, वो डेफिनेटली आप नहीं ले सकते हो, बिकॉज स्टडीज में बताया गया था कि वो इंड्यूस कर सकता है। थायराइड, हाइपोथायरॉयडिज्म, अंडर एक्टिव थायराइड, ओवर एक्टिव थायराइड, उसकी कोई प्रॉब्लम नहीं है। आप रेगुलर थायराइड डिजीज है तो ले सकते हो आप दवाई, लेकिन ओनली मेडुलरी थायराइड कैंसर है तो नहीं ले सकते हो। एंड ड्रग टू ड्रग इंटरेक्शन इज प्रीटी सेफ। ओनली थिंग इज जैसे आप जैसे सर्जरी के लिए जा रहे हो, या कोई लाइक सर्जरी के लिए जा रहे हो, तो यू हैव टू बी NPO, विच इज आपने खाना नहीं खाना है, तो यू वांट टू होल्ड ऑफ ऑन टेकिंग दैट मेडिकेशन दैट वीक। तो वही सिर्फ ध्यान रखना है, अदरवाइज इट्स प्रीटी सेफ टू टेक द मेडिकेशन, इट डज नॉट कॉज एनी प्रॉब्लम्स।
Are there any long-term effects on the kidneys?
It does not. In fact, this class of medication is showing that it is going to improve renal function. और इसलिए वो डायबिटिक्स में, बिकॉज वी आर वरीड अबाउट नेफ्रोपैथी विच इज किडनी को डैमेज करती है, डायबिटीज लॉन्ग टर्म, it actually has shown to improve kidney function. So it does not. However, that said, जैसे because हमें पानी ज़्यादा पीना होता है and you don't feel hungry, you don't feel thirsty, you want to make sure that you actually drink more water to kind of improve your filtration system in the kidneys.
कैन यू डेवलप अ रेजिस्टेंस टू द इंजेक्शन, यानी ये हो सकता है कि दवा थोड़े दिनों बाद असर करना कम कर दे?
नहीं, ऐसा नहीं हो सकता है, नहीं होता है. इट इज जस्ट अ मेडिकेशन एंड इट डज नॉट कॉज एनी रेजिस्टेंस टू द बॉडी एंड it will continue to lose weight or control your diabetes.
अच्छा, अब ये सिर्फ एडल्ट्स में अप्रूव्ड है या फिर बच्चों को भी? क्योंकि आजकल तो ज़्यादा वज़न बच्चों में भी पाया जाता है।
Yeah, I think I'm actually not 100% sure because I don't do pediatrics, but मुझे लग रहा है कि it's approved for 12 years and above. I don't think so छोटे बच्चों में नहीं approved है. नहीं.
सही है। तो वरदा, आपको कोई सवाल है आपके पास?
जी ज़रूर, थैंक यू डॉक्टर शिबा। क्योंकि ये ऐसा टॉपिक है कि बहुत सारे लोग इसके बारे में बहुत कुछ जानना चाहते हैं, तो हमारे पास सवालात भी आ रहे हैं काफ़ी। तो एक सवाल है ऑडियंस की तरफ से कि वंस यू रीच योर आइडियल वेट, डू यू नीड टू कंटिन्यू टेकिंग दिस मेडिसिन एंड व्हाट इज़ द रिलैप्स रेट?
So, like I said earlier, yes, you should be. It's like obesity is a chronic condition, it's an illness, it's like a disease. And just the way you treat high blood pressure, you want to treat obesity. And these medications have been approved for long-term use. In fact, it's better that you use long-term. ऐसे short term के लिए नहीं है. People, you don't want to use it just for cosmetic reason. It is actually going to help reduce your weight and keep it away for long. तो आपने continue करना है. If for whatever reason you reach, I mean, if you obviously you will reach your ideal weight and आपने stop करना है, don't stop सडनली. थोड़ा रिड्यूस करके, टेपर करके धीरे धीरे आप कम कर सकते हो. And then once you go off, you basically, this was a tool and a clutch that you were using to help reach your target weight. And वहां पहुंच गए हो तो you need to maintain it by doing exercise on a regular basis and continue watching your diet. नहीं तो वो पूरा weight आपका फिर से आ जाएगा. It's not that it's a permanent solution. It is an ongoing medication that you take and maintain. But आपने भी थोड़ी मेहनत करनी है जो to maintain that weight loss.
Right, right. Thank you. Another question we have from Talat Aslam. And the question is कि a person with type 2 diabetes who has the HbA1c between 7.5 to 8.5 for some time, and despite of all precautions and cautious eating, how harmful it is for them, and what other medications can be given to them apart from metformin?
So abhi nowadays with the American Diabetes Association, this is also a class that is approved that you can start right away. You don't have to wait कि metformin work कर रहा, metformin add करे उसके बाद ही आप कर सकते हो. This medication can be added right away and it's such an easy medicine. वो inject, I know people थोड़ा डरते हैं कि वो injection है तो मैं कैसे करूं, but you can right away do it. So आप metformin, मैं actually question थोड़ा समझ नहीं पा रही हूँ whether they want to add it in addition to metformin. Yeah,
Gee, I think so. I
yeah.
think so.
So you can absolutely add, if you are tolerating metformin, that's totally fine. It's actually it's a gold standard drug. और उसके बाद आप ये ऐड कर सकते हो. 7.5 to 8.5 is a higher A1C. आपने 7 के नीचे रखना है तो you can definitely get started with either Ozempic or Mounjaro. Mounjaro would be a little bit better because it gives added blood sugar control. तो आप Mounjaro ऐड कर सकते हो धीरे धीरे and then reach to like you don't have to go to the maximum dose. Maybe 2.5, 5 milligrams would be good enough along with your metformin. And that will also help you to prevent, आज अभी नई studies आ रही हैं कि it actually is also helping congestive heart failure in diabetics. So it would be actually beneficial for Mrs. Aziz to take that.
Right, right. So it seems that this medicine has additional role also, जैसे डायबिटीज और ओबेसिटी को केटर करने के अलावा, जैसे आप बता रही हैं। लेकिन क्योंकि है ये मेडिसिन और लोग जानना चाहते हैं इस बारे में, तो अगर आप थोड़ा इलेबोरेट कर दें कि इफ देयर आर एनी लॉन्ग टर्म एडवर्स इफेक्ट्स ऑफ दीज मेडिसिन्स.
So abhi they have been in the market, these two medications. In fact, Ozempic काफी time से market में है वो diabetes के लिए. It doesn't कोई स्टडीज अब तक पता है it's not shown कि it has got long term effects. So it is actually a very safe medicine. And कोई भी स्टडीज अभी आई नहीं है कि it's going to be adversarial to take long term. In fact स्टडीज उल्टी आ रही हैं जो बता रही हैं कि उसकी benefits और क्या क्या है. I have also read a brief article somewhere कि वो डिमेंशिया और अल्जाइमर्स के लिए भी इम्प्रूव होने वाली है. मतलब इट्स गोइंग टू बी अ मेडिकेशन दैट्स गोइंग टू बी हेल्पफुल फॉर दैट. इट इज हेल्पफुल. अभी रीनल जैसे कहा कि रीनल बेनिफिट है, किडनी मतलब रीनल इज किडनी, किडनी का बेनिफिट है, हार्ट डिजीज का बेनिफिट है. सो लॉन्ग टर्म I would reassure all of you that these medications are very, very safe, and it actually has changed the way we treat diabetes, and would highly, highly encourage everybody to consider them if it is feasible and if it is obviously right for you.
Right. Thank you very much for clarifying that. And there's another common question that does a person need to have type 2 diabetes specifically to take GLP-1 agonist?
So diabetes, so because they are basically they are diabetes medication, they don't necessarily have to have diabetes. If they have a BMI of 27 and if they have hypertension, they are eligible for this medication. If they have a BMI of 30 and above, they're eligible for this medication. Only things you have to be careful, कौन सी वाली देनी, and obviously you don't have to know this. Your doctor would know that कि आपने कौन सी शुरू करवानी है. Because if diabetes है तो आप Ozempic या तो Mounjaro ले सकते हो. Yeah, if you're obese, you can take Zepbound or Wegovy. So they are pretty much the same medication, just different brand names catered towards different things. तो ऐसे नहीं है कि diabetes होना जरूरी है. It's approved for obesity as well.
Right. Thank you. Another question we have, does it interfere with absorption of vitamins and other nutrients? And do we need to supplement?
Nahi, does not interfere. How it works is basically just slows down the gut, right? तो वो आपने सिर्फ फूड आपके बॉडी अपने स्टमक में ज्यादा टाइम रह रहा है. It is not affecting any absorption. It's just slowing the motility of the movement of the GI tract. तो आपने ये जब भी लेते हो तभी you don't have to take any multivitamins or anything. It's always good to take supplements and vitamins, but इसके लिए this is not causing or not depleting your body by of nutrients or vitamins. तो बिल्कुल जरूरी नहीं है कि आपने added ये सब करना है.
Right, right. I think this would be one of our last questions. For a person who takes an injection of this medicine, how do they handle this thing when they are on the go?
Yeah, that's actually a very good question because travel बहुत होती है and it is supposed to be refrigerated. तो it is, as long as it's less than 80 degrees and you're not keeping it directly under the sun, आप travel कर सकते हो उसके साथ में. You just, I mean, the prescription, you need to have a prescription with it. That way, if you're going through the airport or something, and if they ask you, then you can show that this is a valid medication. But you can absolutely travel. If for whatever reason you cannot take it with you, and you are going to be away for 2 weeks from the dose that you've taken, तो आपने restart करनी है. Because if you miss the dose for 2 weeks and then you start, like for example, if you were on a higher dose of 1.7 or 2.4, और आप vacation पे चले गए या तो whatever reason you're not able to take it for 2 weeks, and then you restart it at 2.4, the higher doses, you'll actually get severely sick. So इसलिए you're encouraged to actually restart the medication or not stop it. Try to take it with you. You can put in your bag. You can, you don't have to have a refrigerator. As long as it's on the cooler side and not directly exposed to sun, you can actually travel with this medication. And sometimes I tell people, just say, if you're traveling, try to time your dose just before your travel and when you're coming back, because it's a weekly dose. People typically are back in a week or so, as long as they're within the United States. If you're traveling abroad, obviously thoda time lagta hai, but you can absolutely take it with your luggage and inject it wherever you go.
Right, right. That was a very detailed guide, and I'm sure it would help many, many people
Yes.
because definitely travel is unavoidable being here especially. Another question we have, and I think it's a generalized question for people who want to cut down on sugar, I think, sugar intake, I mean. So if a person has diabetes, is Splenda a safe option for them?
I would actually recently, there is a study like also Splenda or any of these sweeteners, you should not it's not safe for your body because they are carcinogenic, meaning they can actually cause cancer.
Mm.
So it's better that you avoid these sweeteners. sh- you can actually use sugar. I again, this is not written anywhere. It's not like, I wouldn't wouldn't say it, but just, rather than a sweetener, I would actually take sugar and thode kam usme, like, but don't indulge in yourself with the sweeteners because they are actually more harmful than benefit.
Right. And would you recommend the natural replacements like stevia and monk fruit?
Uh, um, I don't think, I mean, again, I'm not a believer in this, like, okay, because you don't know what is the monk fruit. Yes. I mean, there are no long-term studies that are showing that any harmfulness or any benefit. So I would stay away from them. I don't, because aage jaake you never know. Even Splenda was pretty good all these years. Achanak say now the studies are there that is showing that there is carcinogenic effect on it. Though, just to be on the safe side, I would avoid it and stick to either no sugar or very minimal amount of natural sugar.
Right, right. Thank you so much, Dr. Zainab. I think with that, we would like to wrap up today's session. And I would request Dr. Sheba Zedi if she'd like to go for the thank you note.
Sure. I wish to take this opportunity to thank the audience. You keep us motivated to do what we are doing. A great thank you to Dr. Zainab Nawab, for giving us your time, for putting in the work. Um, Again, I sincerely appreciate what Dr. Batul does for us. She puts in a lot of time, and may Allah give her sawab for that. So, thank you, everybody. And I hope you have a good rest of the day.
No, I really would like to take the opportunity to thank you very much for, like, letting me do this. I was a little, nervous in the beginning, but I think with thoda overall ho gaya. And thank you all for doing all this hard work, and listeners, audiences, the questions were amazing. And if you have any other questions, I mean, you guys can direct it to IMI Women's Wing, and I will connect with them and try to get your questions answered. Thank you very much और बहुत बहुत शुक्रिया.
Thank you
चलिए,
so
अल्लाह
much.
हाफिज.
And we'd like to mention that a lot of thanks goes to the Imamia Medics International Media team, Sarah Zedi as well. And from our women's wing, we have Dr. Nazneen Zedi, who worked really hard to organize this webinar and bring it forward for our audience. Thanks a lot, Dr. Sheba Zedi, for taking your time and moderating it so well, and Dr. Zainab Nawab for presenting such great information that would always be helpful for our audience, and it will be available on the YouTube channel My TV. And thanks again to everyone for joining us. And I would also like to mention that all these programs are done under the guidance of our Global Chair for Women's Wing, which is Dr. Huma Naqvi. So thanks a lot, Dr. Huma, for keeping all us together and motivating us to keep bringing such awareness webinars for our audience. Everyone, take care. Inshallah, we'll see you again with our next webinar. Till then, Allah Hafiz. Take care.
Allah Hafiz. Allah Hafiz, everybody. Thank you.